There's another challenge cases which is from California. Doctor's name is Mouhannad Almajdalani in Dale City in California. Anyway, the implant site is very small. We had a dilemma with the interproximal contact. With long interproximal contact, this is midline. Okay, central. And here, especially this area is very tiny, as it's getting more challenging. And here too. So my goal is trying to finish the nice golden proportion to make look like teeth. Okay. Here's a canine too. So why I draw this? Because when you draw, then you can see the metal framework just like here. How can you make the custom abutment? Right? So this is custom abutment implant. You guys have to make the implant site. And then finally, we have to finish it. So we have to check the pass of draw. Okay, no undercut. Otherwise, my crown won't go down. That's number one. Engage with the abutment. This is an implant site, right? So, we did it with this. Then make the great custom abutment like that. Okay. So, like I mentioned it, this. Alright, so we have to make the good compensation, the teeth from left or right side. And then we have to finalize it, the lobe design, right? I'm talking about ceramic. And more important here is more neck to make the little shorter. Zirconia porcelain neck, canine as well. Okay, just like here, you see, there's great indications between the tooths here. You see, I like this natural, but I'm not going to follow not exactly like this, but make a little bit something. Okay, so like I said from the beginning, and look at it from this here. Okay, and then we can see this is the shade tab. Number two, the not C4 is there's all over the places. So another tip is when I choose the color, probably C2 and the more enamel, because this is too opaque. Here is very high value here. Okay, and this is really high value. Okay, it's a medium value. Here's the natural teeth look like. I do not like this. Take it out. I love this. I love this. I love enamel. So that's why you can utilize component to here. So we fabricated. Make sense to you? That's the evaluation about the full contour and cosmetic. We can finish them up. Anatomy. Right. So we make the neck and subtle indentations with a different coloring, just like that. Okay, that's good. Now, as you see, here is tiny space regarding the interproximal contact. So they have to use the little bit more. Let's see. So, like this. The tricky is we have to put this one first, otherwise it does not go. So then they can put this one because 8 and 9 has a more room than the other. So this is a good tool, so we can explain to the doctor so they can try just like 3 teeth. So they can take it out, in and out, just like this. Okay. All right, now go to the other one. Size a little bit better than the other. You see the contour like this, yeah. So what I like about the limited space in between teeth, and then we maximize it aesthetics, right? And then not only that, it's not like shade tab, the based on the C2, and then we utilize it a little bit more enamel, the layer and the translucency from gingiva to incisor. Okay. Now K9, the same things. We made the K9 from here, just like that. So they have to try a different way. Well, like this. It's a good contour and shape. Alright. That's the beauty, the part. The last part has a little bit, lack of room, so they have to reduce the here, and then they can try in. So same thing with tricky part, they have to put this first, K9, and then lateral, central, they put it in there. So we recommend this one's a little trim here. Okay, reduce it, and then they can get the passover insertions right. And then they apply the lateral, just like here. Then we finish the final 6 unit cases, which is beautiful. Right? So this is the really limited space, but we're trying to make good long neck in the proximal contact with the contouring from the gingiva. Okay. So totally we have, compared to what we see, and compared to this is lower. Check up. Get the finals aesthetics. Alright, so this is not daily we can get. Possibly you can get, but it's hard to mimic with just like that. So that's why I would like to share with you guys. And the doctor gave us these nice SAMS articulators, and then we're mounting with SAMS articulations and this. Okay, to get the occlusion with the horizontal and side view. Alright, so they can get the final look. Then lastly, I would like to talk about the verification jig. So doctor needs this verification jig because he will going to put this one first after talk down completely. He have to make sure all the way down. Put the number 7, 8, 9, 10, and then put all the way down. That's the final will be. Okay. So I'm glad to share with the tough case to make the really good aesthetic and contouring. Appreciate you guys watching it. My video, like I said, K9 first, and here just a little bit, central first, K9, like that. All right. Thank you.